So I'll go back to 31st of March 2020 when the Scottish Government put in place temporary legislation that sat alongside clinical guidance from the RCOG and from our own Scottish Abortion Care Providers Group. And what that allowed us to do as abortion care providers in Scotland was to provide abortion care by a telemedicine consultation. So taking away the need to see women face to face for a consultation and taking away the understood requirement that every woman would have to attend for an ultrasound scan prior to abortion. So if a woman met the clinical criteria, and very importantly, if the woman wished, she would be able to then carry out an early medical abortion in her home setting, in the privacy and comfort of her home. She would be able to take both of the abortion drugs at home. And the guidance in Scotland allowed that treatment to take place up to 11 weeks and 6 days gestation, so within the first trimester of pregnancy. What we saw as providers in Scotland was during the first 2 months of the post-lockdown pandemic, we saw an increase in demand for abortion care. And across Scotland, there was around 250 extra abortions per month. That did settle down, and I would say over the remainder of the subsequent 8 or so months of the pandemic, the numbers of abortions have decreased to roughly equivalent to pre-pandemic level. I think what's been very interesting, certainly looking at the numbers across the months in my own service in Glasgow, is that there hasn't really been any great change in demand according to the levels or not of lockdown. So that sort of notion that people who require abortions are feckless, they're going out in one-night stands, they're getting drunk, they're meeting people in clubs, actually hasn't shown through in the people that are accessing abortion care. We're all very aware that pubs and clubs, etc., have been closed. And what we're seeing is that really hasn't made a great difference to the numbers of people that we're seeing. What I think is very interesting and a sort of positive outcome over the time of the pandemic is we're now seeing abortion occurring at an earlier stage, so about a week earlier than pre-pandemic levels. So to me, that suggests that access to services is perhaps better, a bit quicker. And very importantly, we know that the small risks that there are from undergoing an abortion get greater with increasing weeks. So the earlier abortions are provided, the better. I would say that across, obviously that's looking at figures across Scotland, there have been some variations in how the health boards themselves have responded to the change in legislation and to the supported model. Virtually all health boards are now offering a telemedicine model with early medical abortion at home, but it isn't quite yet universal. The way that services deliver the model is quite differently. So some services will do a telemedicine consultation, but still need women to travel to the clinic to collect their medication in person, which obviously can be challenging for some people. Some services deliver the medication to a local health facility, so maybe a community health centre, perhaps a GP facility, and some services like mine offer the option to deliver the medicine directly to the woman's house, or if the woman's in a remote and rural area, to post it to her home. So overall, about 75% of women in the board areas that are offering the early medical abortion at home are able to undergo that treatment. So the uptake's been very high. In some board areas, it's even higher than that, my own included. I think we're reassured with some recent publications, and particularly just last week, we've had a publication of a Scottish paper from my colleagues in Lothian demonstrating the safety of early medical abortion at home with telemedicine, and also demonstrating that it was positively received by women who underwent the treatment. So that, I suppose, sounds like a success story, and perhaps one of the few success stories that's come from the pandemic. But I think we're not yet without challenge in Scotland in abortion care. As you'll all be aware, there's been a very recent Scottish Government public consultation. And to me, that's incredibly frustrating, that an element of healthcare which is evidence-based, is safe, is available across many parts of the world, is still subject to public opinion, rather than being provided simply because it's a safe and effective choice. Of course, there may be an outcome from that consultation that early medical abortion telemedicine care cannot continue in Scotland. And I guess we have to be prepared, if that is the outcome, that we make sure service providers can continue to provide rapid access teleconsultation, and perhaps again only provide ultrasound if it's medically indicated. As I touched on earlier, there is still a postcode lottery in Scotland. There's been some improvement over the past few years, sort of driven by the Scottish Abortion Care Providers Group, so that all women should be able to self-refer to abortion services without having to find a GP who will refer them. Almost all services will offer some form of early medical abortion at home, although, as I said, it is variable how you access the treatment. Many people are still subjected to protesters outside clinics or hospital units, and I feel very strongly that as a society we would not tolerate that for any other aspects of healthcare. So I don't know how it is tolerated for abortion care. Telemedicine itself does offer obviously some degree of protection in that protesters aren't going to be able to be outside the house of every woman undergoing an abortion, but it doesn't prevent protests occurring outside clinics and units that are providing abortion care. More broadly, the Royal College of Obstetricians and Gynaecologists that service providers work under their guidance. The RCOG supports the decriminalisation of abortion care, and I sort of feel, as a service provider, if we're providing abortion services in a forward-looking, equalities-based country, then we cannot tolerate that we criminalise women who are seeking health, or potentially criminalise women seeking health care. We do have a women's health plan to be published this year for Scotland, and surely that health plan cannot continue to support criminalisation of abortion care.